Hi, my name is Elizabeth Rimmer and I'm Clinical Director for LPA. I today just wanted to talk to you briefly about what we call the non-surgical facelift, sometimes called a mid-facelift, injectable facelift, and just to tell you very briefly what it's about, who's having it and why, basically. So, the treatment itself is mainly based on using filler products that put some volume into the skin. Can be used also alongside Botox, which works by relaxing some of the muscles in the face and also creating a bit of lift in a different way. So, what I think you out there are getting more familiar with, what I'm hearing, is that actually when we talk about these kind of treatments, it's not necessarily about making you look 20 years younger. In fact, many of the clients that I see don't want to look 20 years younger. They want to look good for their age. And although we know that the problem that filler fixes or addresses is volume loss, actually it's not, the focus isn't on volume when I'm treating. What we're really treating is the effects of the volume loss. And those are things that I call negative attributes. So these negative attributes are basically facial expressions that seem to settle into the skin, directly resulting from the loss of volume that happens as we get older. So what happens is that we start to lose a bit of volume from the middle of our faces, and from that we get a bit of drift, a bit of sag, that kind of, gravity drawn sort of look. And what that can mean for a lot of people is looking negative. So when I say negative, I mean expressions like sadness, anger, fatigue, tiredness. Um, so you can see they're not positive attributes and they're not really the way that most of us would like to be regarded. I mean, it's bad enough looking miserable when you are actually feeling miserable, but looking miserable when you're actually not feeling miserable is a whole nother level of pain. So, what tends to happen as we get older and these changes start to settle into our skin, into our faces, is not so much that people will say to us, "Oh my goodness, you look old." And I think even for us looking in the mirror, we don't necessarily think, "Oh my goodness, I look old." It's looking tired, looking miserable, looking angry. And these are very socially acceptable um, things to discuss. So you will have people saying, "Gosh, you look tired. Are you okay?" Or, "You look a bit upset. Is everything all right?" So where they wouldn't comment, and they certainly don't have any bad intentions on commenting on the way that you are aging, this is actually presented in a completely different way, which does feel socially very acceptable to ask you about. And again, as I said, this can be, pretty upsetting if you are actually feeling very good, very happy, looking after yourself very well, eating very well, exercising, feeling pretty good, to actually be showing the outside world a different portrayal of yourself, and one that doesn't depict your positive demeanour, is really annoying. And I mean, let's face it, we all have days when we do feel tired or sad or angry. But again, really, I don't want that to be written on my face when I'm walking around, even if it is actually, does have some level of truth. So I think the way to look and consider a treatment such as a non-surgical facelift is to move away from the idea of making you 20 years younger to moving towards the idea of making you just look happier, fresher, more relaxed, more confident, just more positive. And that positivity, again, as I've talked about many, many times before, tends to attract kind of positive energy when you're out and about. So a non-surgical facelift sounds extremely dramatic, and it sounds like something, involves, knives and anaesthetic and all kinds of things, bandages. It's very straightforward, with a good consultation, a good practitioner, obviously. The actual delivery of the treatment, the products used, the amount of product used would be something that's very much individualised depending on what your issues are and where your issues are. But it's basically using a kind of combined approach, and I will always stress to you the focus is not on volume but creating lift, getting lift going back on in your skin so that you portray those positive attributes that you want to portray. And therefore, yes, you will end up looking a few years younger, but it's more about, as I say, that kind of positive energy and presenting that image that you want to, which is more accurate about yourself. So if it's something that any of this resonates with you and you think that does sound quite interesting, do get in touch. The other thing I've been talking about with clients recently as well is don't pigeonhole yourself. And even if you have in the past, get ready to banish that, because I'm meeting more and more people now who are saying to me, gosh, I always said I'd never have treatments like this. And I always say it's something I've learned along my life, never to say never. Because it's very easy to say that you'll never do something or you'll never have something until you're actually in a position. And then everything can change. So it doesn't make you super vain, self-obsessed. Most of us do not want to walk around looking like we're an awful lot more tired, sad, angry, frustrated than we actually are. So this is the kind of thing that I can help you with. So yeah, don't be put off. Don't worry if you've always said I'd never do anything like that. Open your mind, broaden your horizons, and just find out the truth, because you know what? Once you've got the truth, once you've got all the information, then you make a really good decision that you feel happy and comfortable with. And whether that's to have treatment or not, but just make sure it's based on good information. So that's it really. I wanted just very, very briefly to give you that lowdown. Mid-face lifting, it's about getting the lift back, getting the freshness back, the fresh factor. I love talking about that. And if you think, oh gosh, I think it might help me, then please do get in touch. We can have a face-to-face consultation, we can have a video consultation, and we can discuss whether there is anything that we can do to improve the way that you look and therefore the way that you feel. I mean, it's got to be good, right? Okay, that's all. Thanks so much for watching this, and you know how to get in touch, and can't wait to see you all in clinic or virtually online, however I get to meet you. Take care now. Bye.